that we're going to have increase in the number of facilities that we would visit in the year 2025 by 30%, that we would have improved compliance and enhancement of data-driven decision-making using data analytics, that we're going to strengthen collaboration between our partners, and we're going to have 25% increase in our compliance rates by carrying out the key strategies. We want to expand our monitoring coverage. We want to enhance our digital infrastructure by integrating a secure online pathway. We also want to include the e-learning platform and our mobile platforms on the digital infrastructure. We want to strengthen our community engagement and build capacity of both the farmer staff and our partners. We want to drive innovation and research. This year, we want to carry out research on quality of care. In doing all of this, we want to make the health facilities in Lagos safer by leveraging on technology and ensuring that all our processes are data-driven. Thank you very much.
Thank you very much, Dr. Onoride, Dr. Nibo Shinowo, Dr. Veronica Iwayemi, and Dr. Abiola Idowu. Your Excellency, the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, the Honorable Minister of State for Health, Dr. Isiaq Salako. Taking us further in a comparative study, I want to especially welcome a professor and consultant medical parasitologist at the College of Medicine, University of Lagos. He coordinates the International Malaria Microscopy RDT Quality Assurance Center, as well as the country's World Health Organization malaria specimen collection sites in the College of Medicine, University of Lagos. Ladies and gentlemen, please let's put our hands together for Professor Wellington Oyibo for the very short comparative study. Thank you very much.
Thank you very much, His Excellency, Executive Governor of Lagos State, the Honorable Minister of Health, here represented here by the Minister of State for Health. Ladies and gentlemen, first of all, this is historic for us. This is a path we have planned, prayed for, and we are happy that this is happening. Mr. Governor, thank you for all and for making this happen, my staff. I'm so happy and grateful to the Honorable Commissioner of Health. He has told the story. So I'm going to build on those stories as I make this presentation. I don't have much time. And part of the whole thing is the advances that Lagos State has made for over 2 decades. The world is hearing it, and the distinct nature of this project through the impact project itself, which is calibrated around the impacts that this project will be again for Lagos State. My slide, please. So what we know about malaria, in the 15th century, why was it called malaria? It was called malaria because the cause of that fever illness was not known. And it was connected to marshy waters. So malaria in Greek is foul. And that was all they could do. And it took some another 100 years before it was connected to mosquito bites. And today we are talking about fever and say all fevers are malaria. So are we going to the 15th century? And this is what we're trying to really unbundle in Lagos as it's still over 50 million people. My slides. So if fever is still malaria, we go back to the 15th century. And then, of course, for evidence base, meant that we will have to quickly provide the evidence. Can I have the slide up? Yes. So the horrible let me just pull it out from here. So I've given this background. Most health workers will not accept the test results when it's negative. And that's the challenge. Next slide, please. Okay, and if you don't have data, which we are talking about digitization, you cannot calibrate where you are. And so if we look at the entire program and the plan of the projects, is to see that real-time data is available and that tests are done. And when the test is done, we can say quickly, cost-effectively, this is where we are. Because you can get the rely on routine data. The country do not have quality data, and that's the challenge. Next slide. So, low confidence in the test. Basic things are being used. Lagos making progress. How do we handle this? 94 to 96% of the reporting for malaria in the DHIS that categorizes states and Nigeria comes from the primary healthcare center, and it's from the public sector. It's important to recognize this. Next slide. And we're bringing this on board because we provide the quality platform for quality diagnosis at the College of Medicine. Next slide. And we do all of this carefully to ensure that these tests are good to be used for humans. Next slide. And what is known? Please just keep on going on the slide because I'll just go through them. There are changes in Nigeria in terms of malaria epidemiology. Next slide. And then we see from the 2021 malaria indicator survey where Lagos is. Next slide. And you can see where we are here at 2.6%. Hopeful. And next slide. Good progress. And we're talking about the path for pre-elimination. We are on that path. And we are happy that this is being mentioned here today. And like I said, this signature. And in line with the stratification strategy and subnational tailoring by WHO. So we are quite on course on this. Next slide. And then you can see the different tests available. You can keep on hitting enter. You have microscopy that is powered by a human being. And then you have this rapid diagnostic test that is technology. But somehow we refuse to accept technology and we stay with humans with all the challenges. So that's what you see with microscopy. Just keep on pressing enter and all of this. And this is the test 15 minutes. The result is out. The other one will take any time. It will be 1 day. And then based on that, we have done the scoping assessment of facility in Lagos.
Recent times, cosmetic clinics. So we're finding it difficult. We have limited capacity to ensure monitoring of these facilities. We also have inefficient manual processes because our digital platform is unable to carry out some of the processes in the agency. We're sitting on a lot of data in the agency.
With AI to make sure that the test is actually having the results that the pharmacy or PPMP says it does. We then verify that the treatment, the appropriate treatment. And then in the impact program, we are to the public health system for malaria-negative patients to ensure that they're getting the proper diagnosis that they need and have a better understanding of what other febrile illnesses patients might have. Next slide, please. Next slide. Okay, so I'll just talk briefly about all of the other partners that are working on this as well. So we are working closely, of course, with the Lagos State Ministry of Health, which envisioned this work and brought us in to support on this, with NMEP, which is overseeing the work and providing technical oversight, with WHO, which is providing, again, technical support and facilitation, and then importantly with our private sector partners as well, so PCN, which is doing quite a bit of the regulatory oversight and ensuring the quality of care in the pharmacy setting, with SFH, which is enabling the supply chain, and then of course with LASHMA, which is to go quickly into the final results on why this is improved quality of care. Oh, okay. Sorry about that. So the The work is providing network expansion, innovative financing, integrated health systems, supply chain resilience, comparative research, and regulatory reform, leveraging all of these different partners that we've mentioned to ensure that patients are able to access quality care, and that the data is being provided back to Lagos State to help improve regulatory support, policy, and other things. I mentioned the partners that we have here already, but we're very grateful for all of the work that they are providing to ensure that there's quality of care in the private sector. And then finally, one final slide. To reinforce what Dr. Wellington said earlier, the work that is being done is also to be supporting with testing, understanding the difference between rapid tests and microscopy, to support on policy reform to ensure that rapid tests are always done before treatment for malaria in Lagos State. Thank you all so much, and we're very excited to be a part of this.
Thank you very much, Dr. Jessica Vernon, the CEO, Maichemet. Ladies and gentlemen, taking us further, Nina Obulafo. Thank you very much.
Thank you very much, sir. Your Excellency, sir. We're very happy that this is happening today. So just permit me to do something unique in terms of our focus for malaria control in Nigeria. To do this, I will call on Dr. Dao, Country Director for Malta. We're going to have the Honorable Minister being tested for malaria. Honorable Minister, thank you very much. This is showcasing the main focus for malaria control in Nigeria, which we refer to as the 3 T's. Your Excellency, the first T stands for tests. We cannot overemphasize or we cannot underscore the importance of that. The second T, sir, is for treatment. Cannot have His Excellency and the Minister of Health standing for long, so once we take their samples, we're going to have them seated again. So can I have Dr. Walter on stage to come and quality check what is happening, sir, please? Thank you very much.
We are witnessing leadership by example. leadership by example by Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, as well as the Honorable Minister of State for Health, Dr. Salako. Please, let's appreciate them. That is the way to go for every one of us all.
Thank you very much, Your Excellencies. So again, this is the way to go for malaria control program in Nigeria. The pre-elimination in Nigeria could commence in phases. We could commence pre-elimination in Nigeria in phases. Thank you, Your Excellencies. Thank you. So back to the fourth bullet on my slide. Your Excellencies, pre-elimination in Nigeria could be commenced in phases. It could start with the states, Lagos State, for example, and we could go geopolitical zones. So I was sitting with my sister, the Commissioner of Health from Ogun State. So the fever for pre-elimination have started. So I also want to say that it stands on Lagos State to make sure that this pathway for pre-elimination is properly done. The National Malaria Elimination Program is waiting to take the experiences and the processes that Lagos will use to achieve elimination to be replicated in other states. Your Excellencies, it's important to note that right now we have a couple of states under 10% prevalence in the country, and those states are Anambra, Kwara, and Rivers State. So what is happening in Lagos that has been flagged off today, it's like NMEP, it's poised to take what these processes and experiences are to states like that. Thank you very much.
Thank you very much, ma. Let's appreciate her. Thank you very much. Thank you very much. Mr. Governor, sir, Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who has been ably represented here today by the Honorable Minister of State for Health, Dr. Isiaq Adekunle Salako. A round of applause for him, please.
Your Excellency, the excellent Governor of the Center of Excellence, Mr. Babajide Olusola Sanwo-Olu. I must recognize my brother, who is one who has summoned all of us here today, the Honorable Commissioner for Health for Lagos State. All members of the Lagos State Cabinet here present, our partners, WHO, World Bank, distinguished stakeholders in the health sector, gentlemen of the press. Because of time, let me say all protocols to be extended. We cannot give the governor for malaria alone. He has to attend to water, to road, to several other things. So I will shorten my speech, but I must say that today I'm wearing two caps. You may not see it physically. I'm standing in for myself and also standing in for my brother, the coordinating minister for health and social welfare, Professor Pate, who is unable to attend because of other assignments. I am most delighted to be at this auspicious occasion of the launch of the pathway to malaria pre-elimination and digitization program in the Center of Excellence, Lagos State, led by His Excellency the Governor, Mr. Babajide Sanwo-Olu. I recall that Lagos State pioneered intensive malaria case management in the early 2000s through the Eco-Free Malaria Initiative, under the leadership of now our President, President Bola Ahmed Tinubu, the then Governor. I am most delighted to be here today to be part of another pioneering initiative now under Governor Babatunde Sanwo-Olu as Lagos State takes the lead in the agenda to end malaria by 2030. Your Excellency, the Federal Minister of Health and social welfare is elated with this giant stride, which aims to improve malaria diagnosis, case management, and accurate tracking of cases through the integration of digital health solutions in the form of real-time electronic reporting systems, all targeted at further reduction in the burden of malaria and its eventual elimination from our land. This momentous project will not only set a track for malaria elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer. I want to emphasize that this project is in line with the renewed hope agenda of President Bola Ahmed Tinubu and the renewed vigor for the Federal Ministry of Health and Social Welfare on the rethinking malaria concept that was launched in April 2024 and is aimed at fast-tracking the malaria elimination goal through strategic shifts. We have continued to make progress in this regard, and the inauguration of the advisory on malaria elimination in Nigeria, Amen, the development of pragmatic costed plan of action, the expansion of permanent care facilities, training of frontline health workers, and the initiation of domestication of affordable medicine facilities for malaria to make malaria treatment more affordable are all testament to the progress we are making. Your Excellency, distinguished ladies and gentlemen, the Ministry is taking these steps in order to reverse the undesirable trend of being the highest burden malaria endemic country globally, accounting for 37% and 31% of cases and deaths respectively. I am confident that Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such case-setting initiative like this program. Furthermore, Lagos has been consistently the lowest malaria prevalence state in Nigeria, as evident from all the malaria indicator survey conducted in the country, with the most recent result in 2021 showing 2% prevalence, hence indicating a tendency of attaining pre-elimination when concerted and consolidated efforts are put in place. I wish to report that the challenge of let me use this opportunity to call on all stakeholders not to relent on their support towards this impactful intervention, which will contribute significantly to the drive at eliminating malaria from the world. Nigeria is ever committed to this drive and we will continue to toe the path of global best practices. I wish to assure all Nigerians and our partners that the change in the policy of the United States government with respect to global health funding will not adversely affect our malaria elimination programs and other public health initiatives, as President Bola Ahmed Tinubu GCFR has approved a robust mechanism to ensure adequate and cost-effective funding for our public health programs. I call on all state governments to join hands with the federal government to ensure that our country becomes self-sustaining in the funding of our public health programs. Before I end this address, let me commend once again and appreciate His Excellency, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, and his health team, led by Professor Akin Abayomi, for initiating and executing this laudable innovative project. I wish to also sincerely appreciate all the partners, World Bank, WHO, all the implementers, especially for providing the needed human resources, technical support, and the funding for the implementation of this initiative. I wish all of us a successful launch of this impactful project as a springboard for the elimination of malaria from our country. Thank you, and God bless the federal government.
Distinguished invited guests, Your Excellencies, Honorable Minister of State, have your results. To say that the Honorable Minister of State confining you in a bed in Lagos, your result is negative. Indeed, when patients go to clinics and the doctors tell you that they've performed the test, it is your responsibility as a patient to see the test. Please ask for the test and take a picture of it and have a record on your phone. My governor, the Excellency of Lagos State, I'm pleased to tell you that you may continue with your duties. Congratulations, sir. Your test is negative, and the low prevalence of malaria in Lagos has been charged a course to elimination. Thank you very much for your support, both the Honorable Minister and our Governor and members of the Lagos State Executive Council. Mr. Governor, if you would like to approach the podium to give your keynote and to launch a pathway to malaria elimination in Lagos.
A practitioner himself and a strong politician, Dr. Thank you very much for finding out. Members of the State Executive Council, especially Professor Akin Abayomi, and Special Advisor on Health. Thank you very much for that cabinet members, all the permanent secretaries in the Health Ministry, and several of you that are here. Thank you very much for taking our time. The Country Director for the World Bank, Dr. Diop, the Country Representative for the WHO, Dr. Walter, all of our partners that are here, MyShamed, Impact, SFH, the National Malaria Organization, our friends from our neighboring state, the Honorable Commissioner for Health in Ogun State, thank you. All of our health practitioners, stakeholders that are here, gentlemen of the press, ladies and gentlemen. When you are asked to come forward and conduct a test that you did not psych yourself for, what will happen is you quickly your brain will raise back and say, have I been feeling unwell? What is going to happen? It just brought us back 5 years during COVID, and they said that they're going to do a COVID test. It was like, the heart was going to open and you don't know what will be the outcome. But you see, it's an important activity that we need to continue to subject ourselves to. You might think it's a simple thing, but it's so important. And that ability for you to come forward, if it has turned positive, what it will have just meant is that we need to make a treatment. It's not a death penalty, but it's really just for all of us to know that we need to do this thing and we need to be able to come forward transparently at all times and let us end all of these things that we don't want again in our sight. Thank you very much. And so it's an honor that I stand before all of you in this room are very strategic to launch the first in the country, another Lagos first, the pathway to malaria pre-elimination and digitalization program. We're here to affirm our commitment to safeguarding lives and the livelihood of every Lagosian. Malaria is more than a disease. It's a social-economic burden that has held back individuals, it has held back families and communities for such a long time. It robs us of our productivity, it drains us of our household incomes. And for many households in Lagos, especially those modest earners, malaria, the name it alone brings shivers. It reduces their earning and reduces their ability to continue to earn more for their family. And so this financial strain often affects families and a lot of times causes heartbreaks and the rest of it. But we're here to put a stop or to even bring a voice to the step at which we want to eliminate that completely. It has affected school children from going to school, it has affected businesses, it It has seen a whole lot of absenteeism and a lot of challenges in our society for several decades. But today, we have to change all of that narrative. The eradication of malaria is not just a good health news. It is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a P, that we need to have, a pre-elimination, the campaign for it, we need to have it, and we need to be able to dot it everywhere. We know from statistics how much malaria has cost our GDP, billions and billions of dollars. Imagine what Lagos could achieve with a lot of resources if we're able to eliminate all of this. We no longer have to choose between survival and opportunity. Imagine a Lagos where every child can attend school uninterrupted because of ill health, or an adult can contribute fully to the economy. And one thing that is instructive was the demonstration of the slide by Professor Campbell, and I saw others as well. I can see that Prof already has a side job in animation and cartooning. It's a job that he can conveniently retire into. And the narratives were very clear. But the message was very, very transparently done. And all of us, in one form or the other, are guilty of this. You feel unwell, you think you have a fever, the next thing is you are diagnosing yourself with malaria. Very easy. Just give me injection. Just give me this tablet. I know what it is. We are all, self-diagnosing ourselves and self-telling ourselves that that is what it can only be and that is what it is. So just give us. But we can see that with knowledge and with communication, a lot of all of those negative things you can rewrite them. And so this program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time. This is digital. Long are those days when you need to take a whole full blood from your body to just do a simple malaria test. I was asking for my bottle of Martina because those days when they take your blood test, it was replenished into a bottle of Martina. But you can see that with just a small prick, and in no time you can actually. That's what digital life, has done. And so it has helped us by strengthening partnership with the private sector. We will expand access for quality care. It will help communities to have the knowledge and resources. It will build a culture of preventing that leaves no one behind. And that's a message we need to come out of from here. All of us sitting in this room must immediately turn ourselves into an advocate, into a cheerleader, to be able to carry this message forward, to be able to tell everybody that needs to know. Go into our communities, pass on this message that this pre-elimination launch program has started, and it's for all of us to see it, to buy into it, and to work with it. The benefit of eradicating malaria goes beyond just health. The malaria-free Lagos, and indeed in future, the malaria-free Nigeria is achievable in our time, and we've all put our minds to it, something that could be done. We believe that if we can eliminate it, it will increase productivity, it will improve educational outcomes from our children, it will reduce considerably our health costs. It would also enhance quality of life. All of these points speaks to a better livability standards, in all indices. And so this vision, though ambitious, I believe is achievable. It requires, therefore, all of us, government agencies, healthcare practitioners, healthcare providers, community leaders, development partners, and indeed all citizens to work together with an unwavering resolve. Success will not come overnight, but will be sustained effort and collaborative action. We will prevail. You saw the slides that a farmer and the lady on malaria and the lady on immunization. You saw the statistics between January and February, what the run rate should be. Yes, we could say that, this is just March, but we need to look to double those numbers. We need to push those numbers to be able to achieve the 2025 target. We need to be able to push and achieve, because there is no magic to it. If your target is 2 million and at the end of February we are still doing less than 200,000, you are doing far less. So you need to double, your spike shoots. You need to work harder, twice as fast, twice as much for you to achieve the 2025 record. And Doctor told us, Prof told us from WHO that it's 2025. They are going to close the envelope. Hello? Yes, you said they are going to close it. And there's a 20. Where is it? I thought it was. They're going to close it. Our target is that we have to take that $20 million. We have to do everything to make sure that we'll meet the criteria very quickly. Because if it's something that we've all said we want to do, then everybody must be on the same page. And I want to commend the farmers and all the ladies that came forward transparently to show us those data. And what we need to do is we don't need to wait in October before we now cry. We need to be able to track this thing on a month-on-month basis. So I want to thank all of you. I want to thank our partners, the World Health Organization, the World Bank, the National Malaria Elimination Program. Our community pharmacists are here. All of our pharmaceutical associations are here. Thank you very much. Our various private and public hospitals, and all of you that are here for your valuable support and making this initiative positive. Of course, permit me to thank in absentia our very hardworking Honorable Minister of Health and Social Welfare, Professor Mohammed Ali-Pate. Our best regards and our best wishes to him. We know all of the things that he has brought about in his tenure as the Honorable Minister of Health. We wish him well. We are also tracking and monitoring, all of his deliverables so that we can say at the end of the day, in your time, you did all of this. And to also thank the Honorable Minister of State for cooperating and operations with the Honorable Minister. We believe that if you do all of these things and you do them well, your time, your time in that ministry will be written in gold, and Nigerians will forever be grateful, because we know that you are pushing everything to ensure that we save over 1 million lives, and you are doing so many things, so many big health initiatives. I want to wish you well. To Dr. Diop, our country director for the World Bank, thank you for your invaluable support at all times, funding your technical assistance. We believe it will continue to catalyze our health initiative. To our country director on the Bill and Melinda Gates Foundation, Mr. Uche, whose organization's investment has been pivotal to malaria control. We say a big thank you. Dr. Walter, our WHO country representative, we believe that your expertise and your advocacy capacity has helped us to push this forward. Thank you very much. To all of our partners, Marshall Mets, who I met last week, I did promise, I said I'll be here in person. And to all of our other partners, please, let's see this as a start to work. It's only when we achieve what we have set for ourselves that we have done the job. They don't pay people for attempts, they pay people for results. And it's the result that is important. It's the result that takes us to that final breaking point in which we all can say that yes, we've done our best, we've contributed what we've needed, and we've seen the results. I believe that we have everything to make it work. We believe we have all it takes to eliminate malaria completely in Lagos State. I want to congratulate our own Ministry of Health. Congratulating ourselves is telling you that you have a lot more to do, Prof, and all of you. But I will be watching, and I will do everything to continue to encourage you. And as a demonstration of that encouragement, I was whispering to Prof that I will also do something different. I will be promoting Dr. Idu as the permanent secretary. Twice as much. To my fellow Lagosians, fight belongs to each of us. Let us embrace a preventive measure like eliminating mosquitoes, adapt, test before treatment. establishment, ensure that we can pass this message: test before treatment. It is so important that we do not just take this for granted. Let us ensure that we can take this advocacy into our communities, into our nooks and crannies, and show truly that once we have started this campaign in Lagos, we will go around every part of the city. We can rewrite the history of malaria in Lagos, and it is in our hand. It's all of us in this room that can help on that. I want to wish you all the very best, and I believe that when we work together, there's nothing, there's absolutely nothing that we cannot achieve together. Thank you very much.
Mr. Governor, sir, may I take your indulgence?
When we were doing interview, she thought I really didn't like her. She was frowning her face one day. It was between her eye and her eye. This pre-examination launch of malaria from Lagos State. Pathway to malaria pre-admission and the sterilization program in Lagos. Thank you very much. Thank you.
Mr. Governor, sir, may I crave your indulgence to quickly invite this Honorable Commissioner for Health, Special Advisor on Health and Permanent Secretary, Ministry of Health, to join you for the first photo op.
we are done. So we are inviting all the permanent secretaries in Lagos State to join the executive governor, actors from the Federal Ministry of Health, all the directors that have accompanied the Minister of State for Health, all the directors in the Federal Ministry.
Optimism is a strategy for making a better future because unless you believe that the future can be better, you are unlikely to step up and take responsibility for making it so. Responsibility is the price of greatness. How else can one explain the thought process of a 24-year-old youth leaving the luxurious comforts in the United States to fill in for his incarcerated father in sub-Saharan Africa, Nigeria, and run a family business holding the fort till stability was achieved? This is the story of Abdul Samad Rabiu, an unassuming, silent achiever. Samad Rabiu attended Capital University, Columbus, Ohio, and returned to Nigeria to oversee the family business when his father, Ishaku Rabiu, was detained by the administration of General Muhammadu Buhari for allegedly not paying the rice report duties. Not only was his father under investigation, the family business was under scrutiny. These harsh realities of being thrust right into the middle of it all shaped the young man's resolve to hard work in silence. Abdul Samad Rabiu is the son of one of Nigeria's foremost industrialists, late Khalifa Ishaku Rabiu, founder of Ishaku Rabiu and Sons Group, a family-operated holding company with a history of investment in manufacturing, insurance, banking, and real estate. In the 1970s, the group invested in manufacturing, with its first investment being the Kano Suits and Packaging Cases Company, a factory producing suitcases and handbags. In 1972, the Bagauda Textile Mill, manufacturing woven clothes for uniforms, importing and trading in different segments of the economy, including frozen food service, sugar, and a motor vehicle and parts distribution company specialized in Daihatsu products. Abdul Samad Rabiu was born with a very big silver spoon in the ancient city of Kano on the 4th day of August in 1960, 57 days to Nigerian independence. 24 years later, responsibility beckoned. He was in the family business till 1988. Abdul Samad Rabiu, following in the steps of the family business, established BUA Bois International Limited in 1988. Solely for commodity trading, Bois International Limited imported rice, edible oil, flour, iron, and steel. The much-needed wins to his sale came in 1990. The government, owners of the Dettol Steel Company, got into a contract with Bois to supply its raw materials in exchange for finished products. This was the young company's much-needed windfall. Bois expanded further into steel, producing pellets, importing iron ore, and constructing multiple rolling mills in Nigeria. Nigerian Oil Mills Limited, the largest edible oil processing company in Nigeria, was sadly bought by Bois in 2005. Bois started 2 flour milling plants in Lagos and in Kano. By 2008, Bois had broken an 8-year monopoly in the Nigerian sugar industry by commissioning the second largest sugar refinery in sub-Saharan Africa. In 2009, the company went on to silently acquire a controlling stake in a publicly listed cement company in northern Nigeria, Sokoto Cement, and began to construct a $900 million cement plant in Ogu-Ogbela, Edo State, completed and commissioned in 2015, which is at that time the single largest non-oil investment in South Nigeria, and had a capacity of 6 million metric tons per annum upon completion of the second line. This was followed by a new 1.5 million metric tons line in Sokoto in 2018 and another 3 million metric ton line, which commenced in 2020 and was commissioned in 2022, bringing the total installed capacity for his cement holdings to 11 million metric tons as of January 2022. Abdul Samad Rabiu is very entrenched with his family in business, having over 40 siblings. His younger brother, Rabiu Ishaku Rabiu, was the CEO of IRS Airlines Limited, an airline based in Abuja, Nigeria. It operates scheduled domestic passenger services. Its main base was Nnamdi Azikiwe International Airport. The airline was established in 2002 and started operations in March 2002 and ceased operations in 2013. Kabiru Rabiu, a younger brother, currently serves as the Group Executive Director of BUA Group. In 2020, Kabiru was named the best African economic leader under the age of 40 in the 100 African Economic Leaders for Tomorrow Awards by the French Institute, Chausseo. BUA invested $300 million in the 20,000 hectares Lafiaji Sugar Estate project, which comprises a sugar mill, sugar refinery, ethanol processing plant, and 35 megawatts power plant. The company also built an export-focused refinery in Port Harcourt, the only destination sugar refinery in sub-Saharan Africa. Abdul Samad Rabiu is constructing a 200,000 barrels per day petrochemicals refinery in Akwa Ibom State, Nigeria. The agreement was signed with Access of France in August 2020 for the refinery aimed at serving Nigeria and the West African petroleum refining needs. It is expected to be completed and operational by 2025. The privately owned Omu Obela Cement Company was in January 2020 merged with the publicly listed Cement Company of Northern Nigeria, where Abdul Samad Rabiu already held a controlling stake in the $3.3 billion transaction, and BUA Cement PLC was born. Abdul Samad consolidated all his food businesses in sugar, edible oils, rice, flour, and pasta milling into a new company, BUA Foods PLC. In December 2021, it was listed on the Nigerian exchange. BUA Foods emerged as a consumer goods leader in market capitalization, experiencing a phenomenal 206% year-to-date appreciation. Share prices soared from 65 naira per share in December 2022 to the current value of 379.9 naira per share as at 24th March 2024. In terms of fundamentals, BUA Foods exhibited robust financials with a 54% increase in profits to 105.6 billion naira in the first 9 months of 2023. Revenue witnessed an impressive 80.95% year-on-year growth, reaching 524.428 billion naira, and return on average equity stood at 43.42%. Despite challenges, Rabiu strategically increased his direct shares in BUA Cement by 56.37%, totaling 96.12% ownership. This move, executed on June 26, 2023, demonstrates Rabiu's confidence in his company's future growth. BUA Foods PLC and BUA Cement PLC companies are among the top 10 most valuable publicly listed companies in sub-Saharan Africa. From a relatively small company in 1988, BUA Group has grown to a world-class conglomerate, contributing significantly to the country's GDP while providing employment opportunities for tens of thousands of Nigerians. Abdul Samad Rabiu's philanthropy is silently second to none. He founded the Abdul Samad Africa Initiative, ASR Africa, and an African-focused fund for social development and renewal which seeks to support Nigeria and other African countries in the area of health, education, and social development. In October 2022, Abdul Samad Rabiu, through ASR Africa, donated $500,000 to the United States Agency for International Development, partner on tuberculosis control, HIV, and gender-based violence prevention efforts in Nigeria. Development of a 7.5 billion naira 200-bed specialist hospital in Kano State during the global COVID-19 pandemic. Abdul Samad Rabiu championed Nigeria's donation to this COVID-19 intervention by a single individual or corporate donating, amongst other things, 1.35 billion naira to the COVID private sector coalition, 300 million naira to the Presidential Task Force on COVID-19, over 1 billion naira in cash donations to 10 state governments across the country, 70 ambulances, medical equipment, face masks, provision of foodstuffs for over 1.5 million persons in Kano, Lagos, and River States. ASR Africa Initiative donated a 4 billion naira police hospital in Abuja and donated 1 billion naira each for 6 universities across Nigeria through the ASR Africa Tertiary Education Grants Scheme for infrastructural development. The beneficiaries of the 6 billion naira tertiary education grant schemes are Ahmadu Bello University, University of Ibadan, University of Maiduguri, Nnamdi Azikiwe University, University of Ilorin, and the University of Benin. ASR African Initiative also donated 2.5 billion naira each through its tertiary healthcare development grants for health projects across 4 geopolitical zones in the country. These are in addition to 5 billion naira donated to build the first teaching hospital in Akwa Ibom State, donated 10 billion naira to the Security Support Fund of the Nigerian government. Abdul Samad Rabiu was awarded the 2022 CEO of the Year at the African CSR Awards, 2016 African Industrialist of the Year Awards by the All African Business Leader Awards, the 2022 Sun Man of the Year Awards, 2020 Vanguard Business Person of the Year, and the New Telegraph Philanthropist of the Year 2021, a recipient of several